Are you someone expecting a child? Have you begun seeking prenatal care? The importance of prenatal care is often overlooked, simply because many parents are unaware of this importance. Receiving prenatal care can avoid complications and defects that can affect your child for the rest of their lives. Here are some important reasons why you should seek prenatal care as early as possible in order to provide the most healthy growing conditions for your child. First, prenatal care reduces the chances of experiencing prenatal death. For mothers who do not receive prenatal care, it is 5 times more likely that they will experience neonatal death. Neonatal death is when the infant dies before 28 days of their life. Some common causes of this unfortunate and devastating result are premature births, low birth weight, and birth defects. As well as a high risk of prenatal death, the child is 3 times more likely to have a low birth weight. This can in turn be a cause of prenatal fatality. Not only does the health risk lower for the infant with prenatal care, but health risks for the mother as well. Some benefits for the mother include that they are more likely to have a healthy postpartum weight, as well as shorter maternal birth hospitalizations. This means the mother is out of the hospital quicker with less complications and is able to be home sooner with their newborn baby. Many women in the United States are receiving prenatal care early on in their pregnancy. About 77% of women receive prenatal care early in their first trimester, whereas about 17% begin care in their second trimester. However, about 6% of women seek care much later in their pregnancy or never receive care at all. It is recommended that the expecting parents find care as early on in their pregnancy as possible in order to receive the most benefits and lower the likelihood of complication. Another reason for seeking prenatal care is to learn about high-risk pregnancies and to discuss your risk with a doctor. Some factors for high-risk pregnancies are diabetes, maternal obesity, and pregnancies with twins. Diabetes is often an overlooked factor that many expecting mothers do not know much about. About 9% of pregnant women are diagnosed with gestational diabetes during pregnancy. This form of diabetes is a glucose intolerance that causes blood sugar levels to become high. There are 2 classes of gestational diabetes which should be assessed with your care provider. Class A1 is more manageable for women who can get through pregnancy with a healthy diet and exercise. However, Class A2 requires the mother to receive insulin and other medications to manage the diabetes. Gestational diabetes thankfully subsides after pregnancy, but the risks for your baby can include the baby becoming overweight or developing type 2 diabetes in the future. Maternal obesity is another high-risk pregnancy factor that can increase chances for stillbirth, neural tube defects, high blood pressure, and other defects. It can also increase risk of heart problems in the infant by 15%. Pregnancy with twins is another risk factor, as pregnancies become higher risk with multiples. Some risks with multiples include premature labor, preterm birth, and preeclampsia. Preeclampsia is when the mother has high blood pressure and even protein in the urine during their pregnancy. This high blood pressure can result in seizures, therefore putting the mother at risk. Although, with the right prenatal care, a pregnancy with multiples can be safe for both mother and fetus. Pregnancy-related death is an uncommon outcome, but one that should be also discussed with doctors, especially when a mother has previously existing conditions. Some common causes of pregnancy-related death include cardiovascular conditions, non-cardiovascular conditions, infections, and hemorrhages. Any underlying condition should be monitored throughout pregnancy to ensure that giving birth is safe for the mother. One important thing that is discussed with your prenatal care provider is medications that the mother is taking. Some medications can be harmful to the fetal development during pregnancy. Prescribed medications that are risk factors for the baby include selective serotonin reuptake inhibitors, or SSRIs, that are used to treat depression, ACE inhibitors to lower blood pressure, lithium, which is prescribed for bipolar depression, diazepam prescribed to treat anxiety, and even some pain medications, such as ibuprofen, naproxen, and aspirin. As some medications are essential to health, the risk factors of not taking the medication increases risk factors for the mother. These risks should be discussed with the doctor to determine what is healthiest for both mother and child. Prenatal care is often an essential way for an expectant mother to learn about fetal nutritional needs, as well as what to avoid during pregnancy. Certain malnutritions may cause developmental issues with the fetus. One thing to make sure you are doing during pregnancy is consuming enough folic acid or taking supplements. Lack of folic acid can affect the brain, spine, or spinal cord development for the fetus. Mothers commonly have the misconception that exercising is not safe for their growing baby. However, it is safe to engage in any normal exercises that the mother was doing pre-pregnancy. Another thing to keep in mind during pregnancy is the amount of weight that the mother should gain. Proper weight gain amounts can vary depending on the woman's normal body weight, and weight gain can be discussed for each specific person during prenatal care visits. While there are many things to consider engaging in, there are also some things to avoid during pregnancy. Teratogens are substances that can cause abnormalities or birth defects to a fetus. Some teratogens include alcohol, tobacco, chemicals, radiation, and other drugs. Even in small amounts or in moderations, teratogens can have a long-term effect on a fetus and should be avoided. Now that you know all this information and risk factors considering your fetus and prenatal care, do not be overwhelmed. Receiving prenatal care is something that women can do at any point in their pregnancy. Whether it is your first or third trimester, it is not too late to seek care from a doctor. Find a care provider that is close by and easily accessible for you. This way, you can provide the safest growing environment for both you and your growing baby.